Kidney transplantation. Welcome to the New York Presbyterian Hospital, Columbia University Kidney Transplant Education video. We are here to provide the very best personalized care to you and look forward in meeting and satisfying your kidney transplant care needs. Kidney transplant is considered the most effective treatment for patients with end-stage renal disease, the final stage of kidney failure. Kidney transplant provides a survival benefit for patients who would need dialysis. On average, kidney transplant patients can expect to live twice as long with a kidney transplant as they would on dialysis. The decision to proceed with a kidney transplant represents a strong commitment to self-care and medical follow-up. Patients who may be helped by a kidney transplant need to undergo an evaluation. The Columbia Kidney Transplant Team performs a thorough evaluation of every potential kidney recipient's kidney disease and general health to determine if transplant is appropriate as the best treatment option. During the evaluation visit, you and your social support will meet with a transplant nurse coordinator, a nurse who will work with you throughout the pre-transplant process, a transplant nephrologist, a doctor who specializes in kidney diseases, a transplant surgeon to discuss your medical history and surgical plan for kidney transplant, a social worker who will assess your living arrangements and social support system, and a financial coordinator who will work to ensure you have adequate insurance coverage for the procedure and medications. After meeting with members of the team, you will be prescribed medical tests and consults to make sure transplant is the best treatment option for you. Once your evaluation and all the necessary tests are complete, the Kidney Transplant Selection Committee will discuss your case to determine the best treatment option. A member of the transplant team will then contact you with the results of this meeting. If the team decides that transplant is the best option and you agree, you will be listed for transplant on UNOS, the United Network for Organ Sharing, the national waiting list. If transplant is not the best choice, alternative treatment options will be discussed. A new kidney may be donated by a deceased donor or a living donor, like a relative or friend. We will first discuss living kidney donation. Most of the time, patients are best served with a living donor transplant because they will have a shorter time on the waiting list. The transplant surgery can be scheduled after the potential living donor's evaluation, and often these transplants can even occur before a patient needs to start dialysis. In general, there is a quick improvement in kidney function. About 97% of living donor kidneys work right away. Finally, the long-term results are better with a living kidney donor transplant. If you have a living donor available, the evaluation process for living donors begins with a medical questionnaire. This questionnaire is a screening tool to determine if the potential donor has any medical or psychosocial conditions that may prevent them from being a donor candidate. It can be accessed on our website at www.columbiakidneytransplant.org or filled out by phone with one of our staff. The donor can call us at 212-305-6469. If the questionnaire is accepted, we will proceed with a blood compatibility test to determine if the living donor may donate directly to you or if you are better suited to participate in a paired kidney exchange program. Each potential donor will need to go through a very intense evaluation process to make sure everything is safe. The donor team consists of a transplant nurse coordinator, a nephrologist, a surgeon, a social worker, and a psychiatrist. For anyone interested in donating a kidney, there is no financial liability. All services, from the evaluation to post-operative care, will be paid for by the potential recipient's Medicare or the employer health group plans, such as private insurance carriers. If a potential donor is accepted to donate to you, a transplant date will be scheduled. At least 1 week prior to surgery, preoperative testing for both the donor and the transplant recipient will be scheduled. Sometimes, donor and recipient pairs may be incompatible by blood type or if the recipient has antibodies against a donor. At Columbia, we have ways to overcome these incompatibilities by offering a paired kidney exchange program or with desensitization treatment. Incompatible donor and recipient pairs can participate in a kidney paired exchange swap program. This is when several patients and their donors agree to donate and receive a transplant from someone they may not know. The advantage is that patients can get a compatible living donor transplant even though their donor is incompatible. At Columbia, we have performed swaps where we have had as many as 4 different donor and recipient pairs transplanted at the same time. Our program also allows patients with compatible donors to participate in a paired kidney exchange or donor swap. This may not provide any direct advantage for the recipient that has a compatible donor, but it does allow 2 patients to be transplanted with a compatible donor. This goal is to help reduce the number of patients on the waiting list, which may be beneficial down the line, and particularly for patients who may have renal diseases that run in their families. It is important to also be aware that there are also certain times where you may have a compatible donor, but you may better be served by participating in an exchange. Another option to overcome incompatibilities between a donor and recipient is to follow our desensitization treatment for the transplant candidate, and this consists of plasmapheresis, intravenous immune globulin, and anti-rejection medications. When a living donor is not available, patients have the option to register on the national waiting list to wait for a deceased donor transplant. The National Transplant Waiting List is managed by a nonprofit organization called UNOS, the United Network for Organ Sharing. UNOS coordinates organ transplantation in the United States. UNOS matches deceased donors to recipients 24 hours a day, 365 days of the year. When a deceased organ donor becomes available, the medical information about the deceased donor is entered into the UNOS computer system, and a ranked list of potential recipients is generated. The list matches are based on blood type, time spent on the waiting list, and genetic similarities between the deceased donor and the candidates. Potential transplant recipients have important responsibilities while waiting on the kidney transplant list. They must notify our center if they have received a recent blood transfusion, if they are hospitalized, or if there are any changes in their medical conditions, social support system, financial status, and demographic information like address or phone number. When we learn that there is a kidney available, candidates may be called at any time to discuss how they are doing and the specific characteristics of the donor. Once in a while, we get called that there is a kidney available that may have something slightly wrong with it. In this case, we will discuss all the issues with you so that you can decide to accept or deny the organ. This will be your decision, but we want you to know that sometimes there are benefits to being open-minded and willing to accept some of these kidneys to decrease the time that you're on the waiting list. If you're doing poorly on dialysis or have problems with your vascular access, we may suggest that you accept the kidney even though it might not be perfect. But if you're doing very well, we may say, let's wait a little longer and see if we can get a perfect kidney. New York Presbyterian Hospital Columbia is an academic medical center. We often have transplant research studies and may ask you to be a participant. Research studies are completely voluntary. You do not need to participate if you do not want to, and it will not negatively affect how we take care of you. Research studies may allow us to give you access to new drugs, which may be better than our standard transplant medications. At times, these studies could be beneficial to you and to our knowledge for transplantation. We will always discuss the details and ask about your interest to participate, but please be aware that participation in a study is 100% voluntary. Kidney transplant surgery typically takes 3 to 5 hours. Patients are given general anesthesia and will wake up in the recovery room. Every patient after a kidney transplant will require immunosuppressive anti-rejection medications that must be taken for life. Everyone's body has a way of finding things that aren't normally there, and the immune system will try to attack the kidney transplant if you are not taking anti-rejection medications. These medications prevent your body from rejecting the transplant. The immunosuppressive medications start at the time of transplant and continue forever. As long as your kidney transplant is functioning, you will require some amount of immunosuppression. The dosages and the number of medications are highest right after the transplant, and they get lower and lower as the weeks and months go by. We will review in detail each medication in a separate video series. It is very important that you are aware that immediately after transplant, your life may become busy and hectic with post-transplant care. In addition to taking medications, you will be required to come to the transplant center pretty frequently for provider visits, lab work, ultrasounds, biopsies, and other tests. These frequent visits will help us make sure that you are on the right path to making your transplant last as long as possible. It is important that you take charge of your health, medications, and following up with routine clinic visits and blood work. Thank you for watching our introduction to transplant video. Our kidney transplant team at New York Presbyterian Hospital, Columbia University looks forward to working with you during your transplant process.